Hi, this is Dr. Simon-Cereijido, and today we're going to talk about assessment of culturally and linguistically diverse populations. In particular, we're going to pay attention on the selection of assessment tools, on what to consider in order to select good assessment tools. Before we do that, I want to go over some common errors. And by the way, this information is coming from a very good book by Barrueco, Lopez, Ong, and Lozano that was published in 2012 that is called Assessing Spanish-English Bilingual Preschoolers, a Guide to Best Approaches and Measures. So, a very common error is to find an English test that we think it is good and translate it with the assumption that it will work as well in the other language, without thinking that there may be different psychometric properties or different equivalencies across the measures. So that's a common error. No, we do not recommend informal translations of existing English measures. Another common error is for a clinician to think, oh, this English test is so good, I'm sure the commercially available version in the other language is as good as the English one. Again, we cannot assume that the inherent test properties of the English version will automatically be transferred to the translation or the adaptation. For assessments, a common error is clinicians do not collect the adequate information, the sufficient information from parents and providers regarding the linguistic variables we have been discussing in class, such as exposure, use, proficiency, relative use, and without that information we cannot really select the appropriate test. Another common error that we have already discussed in class is the use of family members as interpreters during the administration of a test. That is not good practice. It is also important to check the test manuals and make sure that the normative sample of the test includes children like the children we are going to assess. So we cannot use norms if the child we are testing is not represented in the standardized sample. If we make these errors, we run the risk of two different types of errors. These errors will be misdiagnosed. The first one will be to overdiagnose. That is, we will say that a child has a language disorder when the child is typical because the performance, although it's lower in English, it is typical for children who are learning English. And by the way, the same thing could happen with the home language. We test them in the home language and they are low, and that may be the case because the child is going through language attrition. The other side of the coin of misdiagnosis is underdiagnosis, when we identify a child as being typical, but actually the child has a language disorder, but we think that the deficits the child is showing are due to the typical trajectory of a dual language learner. So we can make those two types of errors. Basically, our assessment procedure has three results: appropriate diagnosis or misdiagnosis that may be an overdiagnosis or underdiagnosis. So how do we select the appropriate measure? We need to take into account two basic considerations. First, psychometric properties. We need to select a test that has good basic psychometric properties. The next consideration is cultural and linguistic appropriateness. In this case, we want to make sure that the test is adequate for the other language and for the culture of the child. So let's discuss briefly what we mean when we talk about basic psychometric features. The first one, as you probably recall from other classes, is reliability. That is, how precise a test score is in capturing the skills that is supposed to measure. How stable the results are. Usually, test manuals include a variety of reliability coefficients. These are usually correlation coefficients from 0 to 1. The closer the number to 1, the better the reliability. And in the manual, you will find these types of reliability: test retest, internal consistency, inter-rater or interscorer agreement, and alternate form reliability. The next one, which is very important, is validity: how well a measure actually measures what it is supposed to measure. So this is the degree to which the accumulated evidence from the test supports the interpretation and use of the test scores for a particular purpose. And in the manuals, you're going to find phase validity, content validity, construct validity, and criterion validity that can be divided into concurrent validity and predictive validity. So these two basic psychometric features will be found in the manual, and you will have to look for that information in the two versions of a test, in the case we are dealing with tests that are published in English and in another language. Okay, in the next presentation, I'm going to go over the cultural and linguistic features. Thanks so much.